The Essential Intrapartum and Newborn Care, or EINC, is a set of evidence based practices that ensures safe delivery and newborn care. It promotes survival, health, and bonding between the mother and her baby. Here in the Philippines, EINC is implemented nationwide through the Unang Yakap initiative, which literally means the first embrace. This practice not only saves lives but also strengthens emotional connection from the moment of birth. EINC is guided by two key policy documents: the DOH Administrative Order Number 2009-0025 and another AO Number 2014-0045, which standardized the EINC protocol nationwide. It also supports RA 7600, the Rooming In and Breastfeeding Act, and RA 10028, the Expanded Breastfeeding Promotion Act of 2009. All of these are aligned with SDG 3 of reducing maternal and neonatal mortality. So when we implement EINC, we are not just following clinical procedure. We are fulfilling the country's commitment to global health goals. EINC has threefold objectives. One is to ensure safe, quality, and respectful care for both the mother and the newborn during childbirth. Another one is to reduce deaths and complications such as infection, hemorrhage, and neonatal sepsis, and to promote early bonding through immediate skin to skin contact and exclusive breastfeeding. These objectives remind us that EINC is not only about physical survival, but also about nurturing early human connection and emotional well being. EINC is applied to all mothers and their newborns. Whether delivery happens in a hospital, birthing center, or at home, it specifically focuses on care provided during delivery and the immediate postpartum period, the most critical window for preventing complications. EINC should be performed only by trained birth attendants and nurses who follow standardized steps. Our goal as community health nurses is to make sure that these evidence based practices reach every family, regardless of where they give birth. The EINC protocol is built around four key steps, all simple yet life saving. 1. Immediate and thorough drying. 2. Early skin to skin contact. 3. Properly timed cord clamping. 4. Non separation for early breastfeeding. These steps are proven to prevent major causes of newborn illness and death, such as hypothermia, infection, and anemia, while also supporting mother and child bonding. The first step is immediate and thorough drying, using a clean, dry cloth within 30 seconds after birth. This simple act prevents hypothermia, one of the leading causes of neonatal death. The newborn should be gently but completely dried, especially the head. And bathing must be delayed for at least 6 hours to maintain body temperature and skin protection. As nurses, we need to remember that a warm baby is a healthy baby. Next is early skin to skin contact. Right after drying, the baby is placed directly on the mother's chest. This step promotes bonding, warmth, and breastfeeding initiation. All non urgent procedures, such as weighing or injections, should be delayed. That uninterrupted first hour of life, also called the golden hour, is essential for physiological stability and emotional attachment. Step 3 is properly timed cord clamping, ideally done 1 to 3 minutes after birth or once the cord stops pulsating. This delay allows extra blood and oxygen to transfer from the placenta to the baby, reducing the risk of anemia, shock, and respiratory distress. It's a small delay that has a big impact, ensuring that the baby starts life with adequate iron and blood volume. The fourth step is non separation of the mother and baby to allow early initiation of breastfeeding. The baby should remain with the mother for at least the first hour after birth, or longer if needed. Allow the newborn to self attach to the breast. This stimulates milk production and provides the baby with colostrum, the first protective breast milk. This step promotes lifelong health benefits for both mother and child, physically, emotionally, and nutritionally. After the first hour, the essential procedures should be performed. This includes eye care and vitamin K injection to prevent infection and bleeding disorders. Next is to record the birth data such as weight, length, and temperature. Also, complete physical assessment before discharge to detect any anomalies. These steps complete the continuum of safe newborn care from delivery to postnatal observation. EINC discourages outdated or unsafe practices that have no proven benefit. These include routine suctioning of the baby's mouth and nose, which can cause trauma or bradycardia. Another one is the immediate cord cutting before the placenta stops pulsating. And then early bathing, which increases the risk of hypothermia. And routine episiotomy or fundal pressure, which increases the risk of maternal injury. By eliminating these harmful practices, we promote safer and more respectful maternity care. EINC also emphasizes maternal care. Mothers must receive respectful, woman centered support during labor. This ensures privacy, comfort, and informed decision making. Clean delivery and infection prevention are mandatory, using sterile equipment and hand hygiene. Lastly, continuous monitoring for complications such as bleeding or eclampsia ensures that emergencies are managed promptly. Nurses play a critical role in the success of EINC implementation. Our responsibilities include implementing the EINC protocol accurately and consistently, educating mothers and families about newborn care and breastfeeding, documenting care and reporting deviations to ensure safety and accountability. Do not forget that your touch often defines the mother's birth experience. Let's make it safe, compassionate, and empowering. In the community setting, nurses extend EINC beyond the delivery room. We promote facility based deliveries through education and counseling. We also conduct postnatal home visits to monitor both mother and baby. Most importantly, we identify and refer at risk mothers and newborns to higher level facilities when complications arise. The community nurse ensures continuity of care from facility to home. The EINC protocol is adopted in all DOH accredited hospitals and birthing centers nationwide. It is supported by international organizations like the WHO, UNICEF, and the Philippine Pediatric Society. The program is now integrated into maternal and newborn care training for health workers. This unified effort demonstrates how collaboration between agencies and nurses leads to measurable health impact. EINC success is measured through several key indicators: increased facility based deliveries and breastfeeding rates, a decline or reduction in neonatal sepsis and mortality, improved mother baby bonding and satisfaction. These outcomes show that when EINC is practiced properly, it transforms the experience of childbirth into one that is safer, more humane, and deeply meaningful. The EINC implementation still faces challenges. These include uneven staff training and limited resources in some facilities, resistance to changing traditional birthing practices that may be deeply ingrained, and the need for continuous monitoring and supervision to maintain quality and consistency. Overcoming these challenges requires teamwork, leadership, and commitment from every nurse and health professional. To summarize, essential intrapartum and newborn care promotes safe, respectful, and evidence based care for mothers and newborns. Nurses play a vital role in ensuring that each step is properly carried out, from drying and skin to skin contact to breastfeeding and postpartum education. Every unang yakap, every first embrace save lives, fosters love, and builds stronger families.